Hi, Dr. Fox, licensed psychologist in the state of Texas, an expert in the area of personality disorders. And do you ever find yourself seeking diagnosis to determine what is wrong with you? Like you ask yourself, what is wrong with me? But to try and define a sense of self that tends to change based upon who you're with, what you're thinking, or dealing with at the time, or, right, where you are at the time. And this is due to that unstable self-image that most folks with BPD experience. It's the who am I question. And today we're going to explore it and help you find some answers. So stick with me, like, share, and subscribe. And I have another channel if you're interested. And please subscribe to that one too. That would be great. So let's get into who am I BPD. Okay. So research shows that BPD patients tended to describe themselves predominantly as helpful and sensitive, but also typically reported emotions that are sadness, anger, and anxiety. Now, many of you watching this may be surprised to hear the descriptors of helpful and sensitive. But I have to agree with that, though. And that's because these descriptors, individuals with BPD, do want to help others, and they are sensitive. I think this desire to help others gets derailed by a lot of sadness, anger, and anxiety, as well as other emotions, and BPD symptoms as well, due to that unstable self-image, sort of paired with that sensitivity. For example, you're the person with BPD, right? And you want to help your friends to feel better after a breakup. You listen to her complaints, fears, and desires. This triggers your own core content, which pulls you out of that listening and helper role. And now you're in your own spiral. Now in doing this, you start to seek help from the one who needs your help. So now the role has shifted or it gets disrupted. You get annoyed, she gets angry, right? Which triggers your sense of abandonment and fear, followed by emptiness. And now the relationship becomes strained. Now, impaired insight also causes you to see her as the one who is ungrateful and rejecting, when in actuality it is a confusion of the interaction based upon getting lost in the roles during the interaction. Now, this may be confusing, so you may need to rewatch that example a few times to really grasp it. But this is something that happens, and it is related to that unstable self-image. Now, here's the breakdown, right? Friend needs help. You try to help, you get activated, you get lost, both roles change without awareness, you feel rejected, abandoned, helpless, and empty. Your friend gets confused and feels not listened to, and the mood changes. You get mad, she gets mad, and relationship becomes strained. What happened here is in an instant, right? And is directly related to that unstable self-image and role confusion of who am I? Because it's hard to maintain your role, especially when your core content gets activated. And this can drive you inward to a lot of self-contempt or to cause you to isolate. And BPD causes self-esteem and affect emotional instability related to not knowing who you are, because it always feels like it's changing. Just like in our example, right? When your self-esteem takes a hit, your mood shifts and it's hard to ground yourself, particularly if you've lost grasp on your role in self-image. Now, without insight into this issue, right, which is what we're trying to build here in this video, the who am I impacts all the relationships in your life and causes others to misperceive you, and absolutely causes you to misperceive yourself. So not only do you lack the insight and understanding of your emotional response when your core content gets triggered, and if you're not sure what core content is, I talk about it in a lot of my other videos as well. It's kind of this internal sense that drives what's called surface content, which is more of those feelings, beliefs, behaviors, and patterns that come out of what's really underneath. Sometimes it's loss, abandonment, emptiness, so on and so forth. And this is directly related that when you don't know who you are, you're not sure of who you are, what you believe, what you stand for, because it changes because you so badly want to fit in, that you are actually putting yourself in those situations of self-definition based upon those situations. It's situationally self-defining. but because it's always changing, you always feel off balance. Well, let's try to get a handle on this. First and foremost, recognize that roles change in different situations. As roles change, they don't have to change your perception of who you are, your beliefs, and how you see yourself. Now, this is where you have to do some self-work. You got to work on yourself. That's probably why you subscribe to the channel. If you haven't, please do. But that might be why you're watching the video, is to try to get some self-work done, right? Build some insight. And that's great. That's a huge first step, right? You have to know your roles and those motivations that keep you in your roles. There's a lot of different roles that are out there. There are many common roles like mother, provider, neglector, hero, could be husband, father, blamer, worker. There's all kinds, daughter, lover, friend, joker, the king, right? That's probably more of that narcissistic personality disorder role, right? And their son, parent, failure, scapegoat. There's all these different roles. And figuring out those roles for yourself is really important. That which roles do you fall into with different people. But we also want to get an idea of who you are underneath. Now, you want to explore what those obstacles are that keep you in those roles. Sometimes it's hard to grow outside of our roles that have been defined because people have certain expectations of us. You have certain expectations of others, so they fall into roles when they interact with you as well. So it's not just that it's just going at you, it's you going outward as well, seeing others in their roles as well. Now, I explore this specifically in my narcissistic personality disorder workbook because this issue is very common not only in BPD, but also in NPD as well. So first, think about how you define your role with the following people and situations, right? What is your role with your family? What is your role with your significant other? What about friends, coworkers, strangers? What about at home? What about at work? What about online? Right? Are you building a different persona online, which is very common for folks with NPD as well as BPD? Are you a son? Are you a daughter? Are you a mother? Are you a hero? Are you a scapegoat? Right? What keeps you in those roles? What keeps those roles in place as you interact with others? Next, the next step, right? Then define who you think you are using descriptors, right? Now, these could be kind, patient, fearful. Be careful of using too many negatives for descriptors, right? As we want to balance between both, right? All of us have two sides to the coin, the dark side, right? Go the Star Wars way, go the dark side, right? The light side, right? Depends on which way you're going, but it's a balance between the both. No one is all light, no one is all on the dark side either, right? Because we all have good and bad things about ourselves. All of us do. So it's accepting that as well. That's really important, and objectively looking at those things. Now, what you can do to enhance your positives and decrease your negatives? Well, first off, I want to encourage you to look at yourself, for example, while you're brushing your teeth, and say a positive descriptor to yourself every day. This sounds weird. I know it does, but it actually works, right? You've conditioned yourself over the years that negatives are okay, that you can tolerate negative comments, perceptions, feedback, and all of that for so long. But you can also condition yourself for the positives. And brushing your teeth, not only you do something good for yourself and your teeth, but it also gives you an opportunity. A lot of us tend to brush our teeth, right, in the mirror. So then, when you're looking at the mirror, to say something positive to yourself. Next, what behaviors help define your descriptors? You want to engage in those behaviors that you want to enhance and think of replacement and adaptive ones for those you want to decrease. So you want to engage in more adaptive strategies while you're lessening those maladaptive negative strategies that reinforce that negative concept of self, that reinforce a lot of those negative core content issues that support that BPD. And you want to do this on a regular basis across situations. You can do it in the car, you can do it at work, you can do it at a restaurant before you order, you can do it brushing your teeth, right? This is laying the foundation, the groundwork for a stable self-image. Situations and people don't change who you are. You are, so go and do you, right? that's what you need to do. Get that sense of self, and you totally can. You have to push back on a lot of those negative perceptions you probably heard over the years or that you've internalized, and grow beyond it. And this is part of that process. Please leave any comments about what this process is like for you. I'd love to hear about it. Please like, share, and subscribe. Check out my other channel. That would be awesome. And thank you very much. Take care. Bye-bye.